tinnitus and hyperacusis together, conditions, therapies, and a successful relief. There are increasing numbers of individuals complaining about the combination of tinnitus and hyperacusis, which significantly affects their lives in numerous annoying and unpleasant ways. Typically, they find themselves desperate, constantly searching for help. This combination proves to be much more challenging in terms of symptoms compared to tinnitus alone. Hyperacusis alone can be an extremely annoying condition, preventing sufferers from nearly every opportunity to lead a normal or even close to normal life. With tinnitus added to the mix, the situation becomes significantly worse. It's important to be informed that in most cases, sufferers can find successful help. We aim to convey this message of hope to everyone watching this video. Please remember that we have confidence in our work, having dealt with numerous patients for over 15 years. Our extensive working experience, coupled with acquired knowledge, validates our opinions and renders them helpful to all individuals watching this video while coping with hyperacusis and tinnitus symptoms. As defined in the Clinical Management of Tinnitus and Hyperacusis paper by Susan Gold, which you can find on the ASHA website, ASHA-Wire, of the American Speech Language Hearing Association, I quote, "Category 4 patients have tinnitus and hyperacusis, but have prolonged day or weeks worsening of ear discomfort and or exacerbation of tinnitus after being exposed to noise. This category must be treated very cautiously and requires careful monitoring." End of quote. At the very beginning of her paper, she makes us aware that the understanding and treatment of intrusive tinnitus have changed over the past 15 years. The disorder used to be viewed simply as a problem of the ear. Any discussion of intrusive tinnitus must consider how the brain processes input from the auditory system. Evaluation and treatment have developed into a neurophysiologically based protocol with habituation to the tinnitus as its goal. And finally, as expected, we're reaching the part that once again reaffirms a simple truth. Neuroscience is the key to understanding tinnitus and hyperacusis, as we have emphasized in many of our videos before. In her definition, Susan Gold wrote about a crucial feature of what we understand reading her paper is the neurophysiological model, which is that a number of systems in the brain are involved in the emergence of tinnitus. The cochlea and auditory periphery play only a secondary role. These concepts were first proposed in the 1980s by Pavel Yastrebov, and the clinical protocol for evaluation and treatment based on the neurophysiological model was implemented at the University of Maryland Medical Center in 1990. As this treatment was refined, it became known internationally as tinnitus retraining therapy, or TRT. So again and again, we are going back to what we were talking about in so many of our videos. As we have discussed so many times, tinnitus retraining therapy is so successful because it is the only therapy offering an individualized, non-invasive treatment effective for patients with intrusive tinnitus. The main reason for this therapy to be so effective, with a success ratio worldwide well above 92% when performed in professional tinnitus treatment clinics, is that tinnitus retraining therapy protocols are targeted to work above the source of tinnitus. So the cause of the tinnitus onset, or what has started tinnitus, is unimportant and does not affect the therapy success ratio. Otherwise, and more scientifically speaking, the etiology of the tinnitus is irrelevant. What it means, regardless of the tinnitus initiating factor or cause, whether a patient associates the onset of the tinnitus with noise trauma, medication, surgery, medical problem, motor vehicle accident, or does not associate onset with any known incident, in the end, it has little predictive value for success in a habituation-based protocol. In addition, factors such as maskability, whether tinnitus is bilateral or unilateral, constant or intermittent, pitch or other psychoacoustic characterizations, or level of hearing ability, do not preclude treatment with TRT. Keep this in mind, and I mean really remember it. When it comes to tinnitus therapy, especially TRT and CBT, the only therapies that really work, and you can find plenty of scientific papers backing this up, it all comes down to the hours patients need to invest. They've got to dedicate time doing exactly what we guide them to do and how we want them to engage in certain activities. But the other side of the story is this. The working treatment or therapy is a very active process. We work with our patients by keeping regular contact. If needed, we adjust the therapy and often add new elements of therapies based on the patient's needs. Also, as this is a team effort, sometimes we don't know what and how we will use in the therapy or treatment besides some basic tools. Only by reviewing each case individually and talking with patients can we choose the best options for them. As long as they follow instructions with all our expertise and experience at their disposal, we can be certain that our and patients' goals will be met at the right time. And the timeline varies. It might be a year or take longer in more complex and long-term cases. The key thing to note is that as it is a matter of time and effort, it all starts and must begin with the patient's commitment. Now, we hope you can understand why we frequently discuss TRT or tinnitus retraining therapy and why we strongly believe in its effects and value when administered properly by a truly professional tinnitus treatment clinic. Through a combination of TRT and cognitive behavioral therapy, CBT, along with a highly personalized dose of psychology using many different tools, even cases of tinnitus and hyperacusis at catastrophic levels, as measured by the Tinnitus Handicap Inventory, available on our website, can be successfully treated in almost all cases. Unfortunately, for many individuals dealing with a combination of hyperacusis and tinnitus, effective treatments can be quite challenging and demand a high level of expertise. As mentioned in previous videos, it is important to note that even tinnitus retraining therapy alone requires a considerable level of proficiency. While concepts like sound therapy and habituation are well known, finding a professional with comprehensive knowledge in these areas isn't always easy in the real world. It's similar to grappling with any complex task. We might have a basic understanding, but in reality, we may only be familiar with some concepts or have general knowledge. For example, habituation is one of the key elements of tinnitus retraining therapy. We all know what habituation is. It seems to be something so simple to explain, but what about habituation used in tinnitus retraining therapy? The introduction of the concept of habituation to the tinnitus signal was a turning point in tinnitus treatment. A second important clinical contribution by Professor Pavel Yastrebov was the assessment of sound sensitivity. Again, unfortunately, this is not a part of the standard hearing test designed to validate the tested patient's need for the hearing aid. In the meantime, as we all know, approximately 40% of the tinnitus patients worldwide have at least some degree of hyperacusis, which is decreased sound tolerance. This category also includes patients exhibiting phonophobia, fear or emotional reaction to certain sounds, and misophonia, dislike of certain sounds. As conducted in professional tinnitus treatment clinics, the aspect of decreased sound tolerance should be the most crucial element in proper assessments, evaluations, and treatment protocols. Then again, how many of you can say that the LDL test was performed and the results were explained to you in the hearing clinic where you went to have your so-called tinnitus assessment? I'm afraid not that many. So suppose you are dealing with a combination of tinnitus and hyperacusis, even with high levels of anxiety, especially if there is hearing loss. In that case, we want to emphasize that there is a very significant chance for successful treatment and elimination of all symptoms. This becomes possible when you undergo treatment that integrates all the necessary therapies provided by experienced professionals in one of the many professional tinnitus treatment clinics. So don't lose hope, just do some homework in your search. Additionally, remember that in 2024, as in previous years, many clinics have been proven successful in working with remote patients. Follow-up visits typically occur once every 3 months, and clinics use the internet to stay in touch with patients and guide them through the process. The most crucial aspect of successful tinnitus relief is finding the right place and the right people who can provide effective help. Sometimes distance is not as important as the treatment results and relief. Please be aware that not all tinnitus conditions are equal. The main symptom is usually of the same nature: noise in the ear, ears, or head. Still, there are so many others, and what is even more important is that proper medical professionals should always investigate the cause of the tinnitus onset, starting with a family physician. When tinnitus gradually appears and progresses, it serves as a warning sign. It tells you that you must take action as soon as possible to prevent tinnitus from becoming an uncontrollable monster that will slowly take away pieces of your life. Please don't ignore it, but take steps to address it. Once again, we encourage you to subscribe to our channel. It's where you can find answers to most of your tinnitus-related questions. Our specialists, with over 15 years of experience working closely with tinnitus sufferers, provide valuable solutions and insights. By subscribing, you'll gain access to a wealth of knowledge and support we want to share with all tinnitus sufferers.